This video is going to look at the role of the skeleton. There's certain things you need to know. You need to be able to identify where certain bones are. You need to identify the structure and function of the skeleton, what a synovial joint is, and the different types of joints, and also the movements that can occur at joints. So firstly, we're going to have a look at the structure of a skeleton. Now, you're not going to have to know every single bone listed on the skeleton here. I'll be showing you in a minute what bones you actually have to know on your specification. But you need to know that skeleton is a framework for all your muscles to attach to so that you can actually produce movement. And the skeleton provides a point of attachment for all of your muscles. And the muscles contract and they pull on your bones, and that is what brings about movement. And the movement always happens at what we call the joints of the body. We'll be learning about all the different types of joints that exist a little bit later on. Now, there are certain bones you have to be able to identify in your specification. Don't worry if you don't know where they all are now, because we'll be going through this in class. But it's important you have them listed down in your book. So, the first one in the head is your cranium and your vertebrae, which is in your neck. You've got to know where the scapula and the humerus are in your shoulder. For the chest, you've got to know the ribs and the sternum. In the elbow, the humerus, radius, and ulnar bones. In the hip, you've got to be able to identify where the pelvis and femur are. And in the knee, you've got to know the femur, tibia, and the patella. And finally, the ankle, you've got to know the tibia, the fibula, and the talus bones. So there's a number of bones you have to be able to identify, and they could ask any of these in your exam. Now, regarding the structure, the amount of movement that you're able to produce depends on the shape and the type of bones. So some bones are very, very short, and they allow for fine, controlled movements. Some bones are very long, and that allows you to produce large or gross movements. You've also got flat bones, like in your skull, which protect your vital organs. And then different types of joints allow different types of movements. So different parts of your body, there's all different types of joints, and that allows you to do different types of movement. Now, the functions of the skeleton. Firstly, it provides you with support. Okay, those strong bones keep you upright and hold the rest of your body in place. They also protect you. The flat bones protect your vital organs. For example, the brain is kept inside your cranium, which is a flat bone. The skeleton also provides you with movement. Okay, they're an anchor for muscles, remember. Your muscles attach to your skeleton. And the long bones act as levers and allow you to move. They also provide structural shape. Bones give us your shape, and your height and your build. They also provide points of attachment for muscles to attach to. So when the muscles contract, we can move. They also act as mineral stores. So your bones store calcium and phosphorus and other minerals. And finally, as we learned previously, they're really important for blood cell production. Your bone marrow in long bones, and especially in the ribs, will produce red and white blood cells. So we're going to start having a look now at synovial joints. And one thing you've got to know is the structure of a synovial joint. And synovial joints are the most common form of joint in the body. And they've got a fluid inside called a synovial fluid. And they've got smooth cartilage at the end of each part of the bone. And the cartilage really stops the bone rubbing together. So anytime there's impact, the cartilage will hit each other and acts like a cushion and stops any impact affecting the bone. You've also got a tough capsule which surrounds the joint. And you can see the capsule just over here on the right-hand side of the screen. And you've also got ligaments on the outside. Now, the ligaments join bone to bone, and we'll look a little bit more at them during the lesson. That really strengthens up the joint, having ligaments in between them. Synovial joints are also lined with a synovial membrane, so you can see this red line here. And the synovial membrane produces synovial fluid. So this blue part in the middle here is all a fluid called synovial fluid. and it's produced by this red band here, the synovial membrane. Now, synovial fluid is really important because it lubricates that joint and means the joints can move far more freely and reduces any friction. You've also got something called bursae, and bursae are small bags of synovial fluid, and they reduce any friction around the joint. Now, a joint, and we've mentioned that word many times already, is any time where two or more bones meet or are attached, and it allows movement to occur. Now, the head and neck joint, so you've got the bone in your neck, your vertebrae, which joins with the base of your cranium or your skull, and that allows you to nod your head. So that's a little joint there between your neck and your head bones. You've also got your elbow joint, which is a hinge joint, which has three bones there. So you've got your humerus, your ulna, and your elbow. So there's three bones all joining at that hinge joint. And it allows your lower arm to bend, so that's flexion. And when you straighten your arm, that's called extension. Okay, so you've got flexion and extension at a hinge joint, just like the hinge of a door. It can go two ways. You've also got your shoulder joint. So in your shoulder, you've got a joint between your humerus and your scapula. And again, don't worry if you don't know exactly where these bones are at the minute, because we'll be learning it far more detail in class. And you've also got ball and socket joints. Now these have a large range of movement. They can go forwards, backwards, side to side. They can rotate around. So when we say the words flexion and extension of these joints, it's when you move your, let's say, your hip bone or your shoulder joint forwards and backwards. That's flexion and extension. Or you can move it away to the side of the body or back again. So we've got abduction, which is when you move it away from the body, or joint away from the body. And you've got adduction, where it comes in towards the body. You can turn your thumb towards you. So your thumb has a ball and socket joint there. It can rotate. And although they have a large range of movement, they can be very easily dislocated. So a lot of people dislocate their hips or they dislocate their shoulders when they're playing impact sport. That's because there's so much movement that can occur at these joints. You've also got chest joints. So these are between your ribs and your sternum, and the ribs and your vertebrae. It allows movements to be involved in breathing. So your rib cage moves up and down as you breathe. You've got your hip joint, which is another ball and socket joint between your femur and your pelvis. And this allows for a lot of flexion and extension, abduction, adduction, rotation. Okay, so all those different things that we've already discussed. You've got your knee joint, which is a hinge joint. So between your femur and your tibia. And your kneecap, kneecap or your patella bone, which isn't actually part of the knee joint, it sits just in front of the knee joint. And it allows flexion and extension. So your knee joint, you can flex your knee, you can extend your knee. But also you've got your ankle joint. So this is where you've got your tibia and fibula on the lower leg and your talus bone in your foot. So all those three bones join together to form your ankle joint. And this is where you can point your toes towards the ground. So you've got plantar flexion. You've also got dorsiflexion, where your toes can point up to the sky. You point your toes down, plantar flexion. And you've got the opposite movement, dorsiflexion, where your toes point up to the sky.